So we welcome Angela Glover Blackwell to Brandeis University. Angela is on campus for a couple of days to be honored as the Inaugural Richman Distinguished Fellow in Public Life. And I cannot think of anyone that is better to receive this prize than Angela. Angela is the founder and CEO of PolicyLink, a research and action institute founded by Angela in 1999. And the mission of PolicyLink is to promote social and economic equity in our country by lifting up what works, the trademark of PolicyLink. And Angela has made numerous contributions to American public life, and that's why she's the recipient of the Richman Fellowship. The fellowship honors people that have contributed to social justice, people that have fought for everyone to have the same opportunities, so everything that PolicyLink and Angela have represented over the years. There are many things that PolicyLink has been contributing to, but there is something that is very characteristic of the work that you guys have done, Angela, and I wanted to focus on this idea of lifting up what works. And I think that you guys have always contributed by creating a solution or a policy out of something that started as an innovative idea, a small concept, maybe a local initiative or program, and you have been able to test a solution, to bring it up to scale, and in some cases to transform it into national policy. Mm-hmm. And I can think of many examples of these. For me, very clearly, the very recent presidential initiatives, my brother's keeper to support boys and men of color, also the work that you guys have done with Promised Neighborhoods, and I also like the work that you have done around the obesity epidemic, focusing on equitable access to healthy food. So we are going to use these examples today to try to exemplify the work that you guys have done. And I wanted to start by asking you, how and when did you come up with this phrase, lifting up what works, that has become the trademark of PolicyLink?
Well, thank you. I am so honored to be here and deeply honored to receive the Richman Award. I'm really touched by it. Lifting up what works actually is something that I started to use as a phrase when we first started PolicyLink in 1999. We were so committed to building an organization that valued and understood community building, because we had found that over the years, people in communities had started leading the nation really in terms of problem solving, breaking out of the silos, understanding the relationship between focusing on people and focusing on place. And many innovations were just all over the country, appearing in communities. And so when we started PolicyLink, our purpose was to do policy from the wisdom, voice, and experience of people who were working for change in their local communities. And so as I started to introduce PolicyLink, I often use the phrase, what we're doing is lifting up what works. We think that you can identify a problem any place, and we can show you a community where people are really working on it and working on it effectively. We need to lift up what works, shine a bright light on it, and get those things embedded in policy. We had a vice president for communications named Janet Dewart-Bell, and Janet kept hearing me use that phrase. And she said, you use that phrase all the time. We need to be more deliberate about it. It became my tagline. We got it copyrighted, and we've just been using it ever since.
And you made it happen.
And now I hear everybody saying it. Maybe everybody was saying it before, but we're the ones who just started writing it down and pushing it out there. Lifting up what works is such a hopeful phrase. It suggests that something works, and that if we lift it up, maybe we can do something about it. And when we started PolicyLink, we wanted to be positive. We wanted to take an issue that often gets described in terms of the data of disparities, that gets depicted in terms of suffering and oppression, and we are very much aware of that. We never ignore the reality. But we think we need to use that information to start finding and advancing solutions. And we thought lifting up what works was a hopeful way to say we're in the struggle too, and we're moving toward the solutions.
Let me add my congratulations. I think it is both a perfect and an inspired match that you're the first recipient of the Richman Award. I've known you and your work in the organization for quite some time, and am very proud that on some small projects that we were able to partner together. I'd like to go back to the lifting up what works. There is a lot of proven success of things that work, and we know from small demonstration and pilots. How does PolicyLink decide which ones to lift up? That is, if you are you thinking about outcomes? Are you thinking about the process? Or are you thinking about both together?
We think a lot about the process, and we're thrilled when we have outcomes that we can also point to. We actually have a belief that if you go about things in a certain way, it's going to lead to good outcomes. We think getting out of the silos and integrating people in place, having authentic community engagement that's really guiding what's going on, being able to build on data and information so that we're not acting as if we don't understand the problem or acting as if we don't plan to produce results. So this use of data for continuous improvement and measuring progress. So we look for that kind of process, but also when things are making a difference, it gives a lot of momentum and credibility to lifting something up. So it's really a combination. But we're very entrepreneurial and opportunistic about what we pick, because sometimes you can create a buzz out of nothing and get something in place. But when a buzz is emerging, you really need to jump on it. And we tend to do that. The things that Dolores mentioned in terms of promised neighborhoods and access to food, which is the Healthy Food Financing Initiative, and My Brother's Keeper, all of those things actually allow us to be able to identify some momentum in society and the policy world, identify something that is promising, working, or proven in terms of being evidence-based, and really use communication and organizing and policy development to be able to make sure the moment connects with the best that we know that's out there.
Could you give us an example of a particular initiative that for you exemplifies what strategies are key for transforming an idea or small initiative into national policy?
Absolutely. The first one I'll use is Promised Neighborhoods that actually started with the Harlem Children's Zone. Most people know the Harlem Children's Zone, Jeff Canada, and the amazing work that they've done in a geographic area in Harlem to make sure that all the children in that area can reach their full potential, starting with birth, going through career. It was not surprising that when then Senator Obama was running for president, said if elected, he wanted to build on the Harlem Children's Zone and do 20 such programs around the country. Jeff Canada is a dear friend on the board of PolicyLink, and I actually was one of the few people outside of Harlem who was on the first sort of planning committee to develop the Harlem Children's Zone, so I had an early connection with it. Jeff said, you know, he may or may not get elected, but wouldn't we feel silly if he did and somebody else designed the program? And so Jeff and PolicyLink, the Harlem Children's Zone and PolicyLink, combined staff to be able to design the Promised Neighborhoods. But what we did was we really took apart the Harlem Children's Zone. The first issue was Harlem is a very concentrated, dense area. How do you do a program like that in Los Angeles or Houston or the Mississippi Delta? So we did a mapping project to show that in different geographic areas you could get to the level of numbers that would make a difference for scale. We looked at the program and found out, yes, it works, but what are the basic principles that allow it to work? Like using data for continuous improvement, authentic community engagement, requiring a very professional staff, those kinds of things. Then we looked at how you would model the program. How would you have a planning period and an implementation period, and how much money would be needed? So we did all of the work of looking at the program that was working, thinking about what's important about it, how would you spread it to other places, what would be core to not replication, but application of the best that we know in a different environment. So we did all of that, put it in a notebook, and then we got aggressive. Here was this moment, the transition period. The president had been elected. The transition team was in place. We took this notebook to the transition team, met with them and said, if you decide that you want to pursue that Promised Neighborhoods idea, here's our best shot at how you would do it. So that was good in and of itself, but that wasn't enough. We also had a big national convening. And we told people the Promised Neighborhoods are coming. Bring a team and learn how to bring your A game to be competitive for the program. The team had to include community residents, your superintendent, Somebody from a local foundation, no fewer than 5, no more than 10. 1,500 people came. So that the momentum that was in place by the time the president actually announced the program was extraordinary. Finding something that works, shining a bright light on it, doing the work to understand why it works and how would you do it at scale, and then doing the organizing and the political work and the communication work to help get something in place.
That's a great example. Let me ask a question about scale. Scale gets a lot of play in the literature, and people, I think, have some very different understandings about what scale is. There's one way of thinking of scale as a universal process. That is, everybody's got the exact same shot at it. And there's another way, on the other end, it seems to me, of thinking about scale as a scale is defined as getting people to an objective, to a goal, to something that's highly valued, like retirement security or educational opportunity, whatever example we want to use. And then think about scale with the understanding that different groups in the population have different challenges to get to that universal. How does, in promised neighborhoods and in your thinking about scale, how do you think about scale that way?
I think that the way that I think about it is universal goals and targeted strategies. And that's also a good organizing and communication frame. When you identify a universal goal, usually it's something that across the society people decide this is important for societal purposes, like public school education. Now we're actually having quite a consensus around the need for high-quality preschool education. So let's just take that. High-quality preschool education so that all children in the country can begin school ready to learn. That's a universal goal. But just making it a universal goal doesn't mean that everybody's going to get it. And in this country, where we don't really pursue our universal goals necessarily with a complete public strategy, you have lots of people who provide it because they have the money. And then you have programs for very poor children like the Head Start program. That leaves out a whole lot of people. And we need to have strategies that ask who's being left out and how do we make sure that we target it so that we have some strategies that really focus on recent immigrant children, some strategies that focus on families where mothers are at home or fathers are at home and able to get children to programs, some where parents are working low-wage jobs that don't allow much flexibility. So thinking about a universal goal and a targeted strategy is a way to ensure that you can get to scale if scale means universal access. Sometimes scale just means, though, taking something that is obviously effective and making sure that it can be scaled up within that group of people who need it, which is not necessarily universal, but at least it doesn't remain a one-off boutique program that only a few people get to have access, like the Harlem Children's Zone. If it only stayed in Harlem, even though 10,000 children, there's a lot of children, that's a drop in the bucket in New York, not to mention the nation. So thinking of taking a program like that and making it available in poor communities of concentrated poverty, getting that to scale is not universal, but it contributes to a universal goal of making sure all children can reach their full potential. So I think it varies from one situation to another.
That's very helpful.
I had a question about promised neighborhoods because I've noticed that something that distinguishes PolicyLink is that you guys are there when something is being created and for all the dissemination and public relations around it, which is wonderful. But I also always involved in the really hard technical work that is behind an initiative as the technical assistance arm of a policy, or just keeping momentum and trying to bring that even more up to scale like Promise Zones now. So can you talk about that process, like goes behind the scenes, about like the really rigorous technical work and how that helps promote a policy further?
Yeah, I do think that PolicyLink is an unusual organization in that it's hard to say exactly what we are because sometimes we feel like an organizing group. Sometimes we feel like a communication apparatus. Sometimes we feel like technical assistance, sometimes advocacy. But I think that what it is we respect the iterative process of really good policy. That if we're trying to identify things that are happening on the ground, it's important to be close to community so that you're not just going at the thing that happens to be getting attention, but that people in community feel that it's important. It's important to work with community in getting a policy in place. You can't just impose it or do it for. We think local leaders are national leaders. They're solving the nation's problems, and they need to be thought of as policy advocates too. So working with community to be able to push for something to happen. Then being an advocate and getting it in place. But getting a policy in place does not ensure faithful implementation or the kind of engagement that allows it to continue to learn. And so the iterative process is, once you get a policy in place, going back to community and saying, here's what we're hoping this policy will do. What skills do you need to be able to do it? Too often, I think people who do evaluation of programs end up finding that something isn't effective because the outcomes aren't achieved. But really, the implementation is probably where things fell down. And to assume that it wasn't successful doesn't mean the idea wasn't good, but the capacity to be able to do what one had in mind was never developed. And so we really like to invest in that capacity. And that's what we've done with Promise Neighborhoods. At that convening that I described where the 1,500 people came, a good number of those people were funders. And as they thought about the Promise Neighborhoods program, they realized there needed to be an independent capacity building entity that was put in place. Thus came the Promise Neighborhoods Institute at PolicyLink that works directly with the leaders and the community of these initiatives to help make sure that they're using data for continuous improvement. We actually helped the ones that are doing the implementation grants as opposed to the planning ones all get on the same data platform so that we could not just tell the individual stories of the individual Promise Neighborhoods, but tell the story of the Promise Neighborhoods initiative using the same data to report out. We help those leaders learn how to lead to results. You know, it's easy to say we want you to get results, but how do you make decisions every day in relationship to those results? And we're working with the Annie E. Casey Foundation to rigorously train and build the capacity of the leaders to be able to get those results and understand how the decision making and the staffing and the measurement, how that happens. We've done something similar in another area. This whole issue of access to healthy food in low-income communities. I always say you can always know when you're in a poor black community in any city because all of a sudden you can't find a grocery store. It's really outrageous that something as basic as a grocery store is not in place. It's a long story. I'll come back and tell it if you want. But the end of the story is there's something in place in this administration called the Healthy Food Financing Initiative that makes grant and loan money available in underserved communities to get more grocery stores, farmers markets, or to help corner stores actually have the refrigeration and the capacity to sell fresh fruits and vegetables. Great that that's in place, but people need to have access to each other and access to best practices. And the Robert Wood Johnson Foundation funds PolicyLink to run a food portal, which allows all those groups that are trying to either use the Healthy Food Financing Initiative money or find out how it's being used to have easy access to strategies, examples, problem-solving networks, webinars to move forward. Very important to keep that iterative process going.
That's real important. You know, especially Dolores and I both teach at a school of social policy, so having this conversation is great because often I think that the question of implementation and design is kind of the dark box that no one really looks at. We kind of think there's some good people, maybe some good people in Washington or Sacramento or a state capital or your local area that comes up with a policy and then maybe funds it and walks away. And it seems to me you're really emphasizing the iterative process of making sure the community is involved and making sure that the design and what's in that dark box really represents the features and the goals of the policy. And I love that. And again, coming from the School of Social Policy, it's often what's missing in our understanding. A question I'm thinking about some of the challenges of organizing and advocacy. And to me, there are lots of challenges, otherwise we wouldn't be doing this work. One of the challenges has to do, I think, with what we call the siloization. We have actually, I think, a lot of capacity across the nation on some relatively narrow issues. How does PolicyLink begin to get some cross-sector collaboration and breaking down those silos so people and organizations don't fight over turf and work together? And I think it's a relatively recent article in the Stanford Innovation Review that talks about this in terms of collective impact.
Well, from the very beginning of PolicyLink, because we came out of the community building movement, we understood that it was important to break down the silos and get all of the groups that were working for change working together and understanding that they were often working on the same thing. That transportation policy really is health policy and job policy and education policy. That you could take education and say the same thing. That you can't solve these problems working within a silo because people's lives don't come in silos. They come all together with all of the complexity. And so PolicyLink, both in our initial proposal to foundations, we talked about housing and education and transportation and wealth building and job creation and all of those things, and talked about the importance of place, because it is in place that everything comes together. One of the things that we often say is that in America, where you live is a proxy for opportunity. And so we find two ways to be able to help people break out of their silos. One is to look at a place and to look at what is happening in the place and get all of those actors who impact the families in a neighborhood or another kind of geographic area to see how collectively they can have impact and how collectively they are having impact and it's not being maximized because they're not talking to each other. So going to a geographic area and getting people to work together. Another way is to think about a common outcome. And we have been doing that a lot, looking at the demographic change in America and making the point that as we rapidly become a nation in which the majority will be people of color very soon, and the majority of children will be people of color by the end of this decade, that we really need to think about what do we need for the people who are going to be the future to have and be able to do for the future to be bright. Lifting that up also pulls people together because it brings a new urgency and a collective sense of working on something together. And PolicyLink works on all of these things. Sometimes we lead with housing, sometimes we lead with transportation, but let me just take transportation for a moment. We actually started working with Transportation for America when they were organizing to try to impact the reauthorization of transportation. We felt that we needed to lift up the equity agenda within that work because we think that equity, when I say it, I mean just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. That transportation has a lot to do with thwarting equity. That if you don't have a good transportation system, you're not going to be able to connect to opportunity throughout the region. And there are many other things that won't happen. So when we got involved with transportation, first we just started talking about equity. Then we thought we could have more impact if we actually had an equity caucus. And when we pulled together the equity caucus, we were able to attract people from the disability community, from the civil rights community, from the workforce community, from the EJ community, who weren't necessarily seeing themselves in transportation, but they saw themselves in equity in transportation. And that helps to be able to break down the silos, too, when people from multiple disciplines see that a discipline that they haven't been a force in before impacts what they do, and then that gets incorporated into their work. So there are lots of ways to break it down, but if you don't pay constant attention to it, things just move right back into silos. That seems to be the natural state for the work that we do, and you have to constantly pull it out.
Right.
You have mentioned philanthropy a couple of times, and I know that you have worked very closely with foundations throughout your career. I think it's very American to use the power of philanthropy and combine it with the power of policy. Can you talk about using any of the examples that you've been using, maybe also the new initiative for boys and men of color, about how you have been able to leverage philanthropy in advancing public policy?
Boys and Men of Color is a perfect place to talk about it. I am so pleased that the president has lifted this up in terms of the My Brother's Keeper initiative, but I'm even more pleased the way that city governments and philanthropy and community-based organizations have both felt free to talk about boys and men of color and bringing a lot of discipline and smarts to the issue. It's taken a long time for us to be able to do the kind of targeting that I talked about earlier in terms of universal goals and targeted strategies. Boys and men of color, particularly black boys, occupy a special place that needs special attention in America, both because of the history and legacy and continuing discrimination. But the incarceration scandal has just been outrageous, and it's outrageous certainly for those men who are incarcerated, but it's outrageous in terms of the way too many black boys and young men see themselves as incarceration being a natural part of their development. And it impacts in terms of the legacy of absence that is left in communities as black men have been pulled out, leaving women and children to struggle on their own for economic advancement, democratic participation, safety. And the fact that when these men come out, they're not able to really be participants in community. So it has been hugely devastating, and it is also being felt even more than in the black community, in the Native American community, and emerging as an issue in the Latino community and segments of the Asian community. And so what's happening to boys and men of color has been hugely important. Thinking about it and acting on it has gotten many foundations funding in that arena. And Bob Ross, the president of the California Endowment, really took the initiative in terms of getting the California Endowment out there on the issue. They have a Boys and Men of Color initiative. It has a statewide advocacy component, and it has an on-the-ground component. And Dr. Ross took 3 months off on a sabbatical and used that time to travel around the country looking at what was happening with boys and men of color, and then coming back and talking with his colleagues. And he and several of his colleagues pulled together 27 foundations a year ago at the Council on Foundations meeting to talk about how they could come together and be more deliberate about their individual learning and to share it, to be able to create more resources focused in this arena, and to really put money out there that could change the narrative and come up with policy fixes. Right when they were getting off the ground, the president began to focus on inequality. And in focusing on inequality, you got to focus on boys and men of color and what that's doing, which led to the announcement of the My Brother's Keeper initiative, in which foundations and the federal government are consciously working together to augment each other's efforts. And so PolicyLink has really been quite honored to be a part of helping to think that through. It's going to be hard, and it's going to take a lot of staying power, which is why I'm glad to see foundations involved, because while I don't think foundations are necessarily known for their staying power, at least they're not on a 4-year cycle. So they have the ability to be able to at least keep this going after the Obama administration is over. But I think that foundations really are so crucial to the kind of advocacy and policy work that we're seeing. Many foundations are afraid of advocacy. They're afraid of crossing the line that will cause them to lose their charitable status, but they can do a lot in the policy arena, and they can certainly support grantees on the ground. And I have been to many discussions at various Council on Foundation meetings and other meetings of philanthropy in which they are really pushing the envelope, finding out what they can do, and acknowledging that if they have a goal for their foundation, it can't be fully realized without doing policy. And so I think we're starting to see real energy coming from the world of philanthropy to be able to see their quest for improvement all the way through to its logical end.
I think that's great, and I want to thank you for the seminar on lifting up what works today, and I hope that we will continue these conversations in different venues in different ways. Thank you very much.
Thank you both.
Thank you, Angela.